Mhm. Oh, thank you. Good thinking. It takes a village, definitely does. So let me get out of that. Okay. We always have technical difficulties no matter what. So, the mission of Idaho Partners for Good is, like I said earlier, we're trying to reinvent how everyone in our community, people just like you and me, give and share our expertise and do greater good together by combining our superpowers and our networks to kind of work together to have this collective vision, which is to develop stronger, healthier, and better equipped nonprofits, like I said, so they can do more of what they do best. So, I want to introduce our panel. We have such an amazing group of individuals that have come alongside us from the beginning and at different parts during our process to share their expertise and the things that they're the very best at. And data is one of those things that you really have to understand and you have to embrace. But what's even more important is being able to understand how to take data and understand and communicate what it actually means. There's a story behind data that a lot of times gets lost. And so I'm so excited that we have Foster Cronin and Lance McGinnis Brown here, which are experts in these fields of technology and data, and as well as storytelling, that are going to be joining us here today to explain to us something that we're doing that I'm really excited to share with you. So, a little bit more again about the other things that Idaho Partners for Good does. We have our nonprofit success labs, like we're doing here today. We have our leadership cohorts that are very successful in helping nonprofit leaders get the skills and the mentorship that they need to do more. We have our consulting team, which is experts like we have here today that work with philanthropists and nonprofits and also other organizations and agencies to improve their teams and their leadership functions. And we also work with others on how they can give better, as well as creating this consortium of people that have like interests and hopes and progress that they want to make. So, with that, I would like to kind of work with Foster a little bit and explaining a little bit more about what we're doing here today.
So before we get into this too deep, let me give everybody kind of a level set. Um, Last summer, we sat down with 11 different philanthropic organizations, and they were everything from local here, small, large, and asked them a set of questions so we could kind of hear from them what the common themes were going into 2026. Um, that kind of shaped the creation of these listening sessions. Uh, we talked about what do you do with this information now that we have it. So we went out to some nonprofits and kind of made sure that everybody was on the same page and hearing the same thing from the people that and the funders that they were talking to. Um, one of the things that I kind of felt strong about was I've worked in big companies where you have a consulting team come in and they make lots of recommendations and then they leave and you have to figure out what to do with it. So we didn't want to just leave and drop this out on people. We wanted to come up with a playbook, which we did. We've talked to a bunch of different people about what this playbook looks like for Idaho. We went into the first part of this year in January and ran, I believe, there was about 6 different workshops uh, with state leadership and influencers, and we've partnered up with some pretty heavy hitters, including Patricia Kempthorne, and we're this is not something that you're going to see today. What we're going to talk about isn't something that we just developed on the fly without talking to people. This is something that's been a work in progress uh, really since last June. So we're going out now and we're sharing it with people. We're trying to refine it. So if you have any comments about, we'd like to see maybe this change a little bit. I want this to be an open discussion as we go through it. But what you're going to see is where we're at after really working pretty hard on this for about 9 months. So with that, I'll start, Brian, the guiding principles of what we're going to talk about. and this is what we heard in all of our workshops and listening sessions. Everyone has a role to make a change. It doesn't matter if you're a large business or a nonprofit, or if you're just trying to help a neighbor next door. You want to take the next one, Brian?
Yeah. So also those listening sessions and getting feedback from people that we're working with. Again, as Foster said, this isn't just something that we came up with. This is something that we intentionally reached out to, interested parties, vested parties, people with a heart for our neighbors that we live here all together in Idaho to get their ideas on what does Idaho mean to you? What are our shared values? What are things that we all want to see, regardless of our background, regardless of where we come from. And we were able to come together with a list of similar themes, a list of similar words, dreams and aspirations that we had, the things that we love the most about Idaho. And we want to protect those things that make Idaho special and make Idaho this place that we call home. And that's it being a welcoming place, a place where everyone can afford to live and prosper, protecting each other's dignity and treating each other with dignity and respect. And again, coming back to opportunity, we want people to have the opportunity, and that means everyone to have the opportunity to thrive.
The third guiding principle, excuse me, is prevention that protects people and resources. We heard over and over and over again about what we're kind of referring to as this domino effect. Uh, we heard from nonprofits, we heard from the funders. Uh, we need to invest upstream, and it will unless we invest upstream, I guess is maybe a better way to say it. Uh, we're going to have problems downstream. So every dollar that we invest in healthcare, for example, upstream is going to help save people money, and downstream the loss of Medicaid, for example, is maybe a good place to start. And we'll talk more about these here in just a minute, but um, reducing the crisis downstream is going to be important. And I think we really heard over and over that you've got to spend money upstream if you're going to eliminate that downstream crisis.
Thank you, Foster. So our four pillars, and the one that we're really going to focus on today, but we want to make sure that we go over each one of these. These are the action steps. These are the things that we're actually going to be doing to take those vision, those guiding principles and make them actionable steps to make a real impact. So here we have, data and making it visible, the data combined with what the actual stories are behind these number graphs and these bar charts and these, different points of numbers. And these are areas that are very important to us all, like housing, food insecurity, healthcare, helping protect and guide our youth, and reduce some of those comorbidities that combine to keep everyday people that are, to the house to the right of us and the house to the left of us, what's really impacting them and what does that look like and how can we communicate what those numbers are in a way that get all Idahoans engaged in finding a solution together.
Two is about how do we get people out there and start helping with this? How do we mobilize? We're trying to engage local champions. I talked about that a little bit earlier. Um, we're going out to universities and trying to get students involved in what we're working on. We're looking at younger leadership. We've talked to several people from Idaho state government about what we're trying to work on and getting them involved in this, as well as church organizations. It only is going to work if we're getting everyone from every different strata in the community involved. And that's what pillar three or pillar two is really about.
And speaking of getting everyone together in collaboration, so we have to work together. And I love how all of these pillars and these guiding principles that they dovetail together. They're a continuum. This has to have cross-sector collaboration. You know, we aren't in silos. A lot of times it's easy to get into silo thinking, but every sector, every individual, every community has a strength and has a perspective and has something, a solution, or a resource that they can provide to solving some of these issues and getting ahead of them. For instance, something that we're going to be doing for Idaho Gives is we're working with 5 other nonprofits to help elevate their voice, and bring new eyes, and new community, to wrap around these nonprofits because, again, housing, food, healthcare, we're all working in these areas together and there's that overlap. And that's Pillar 3 is a great example of just such a process.
Color four, it seems obvious, but one of the things that again we heard over and over again was we need to strengthen the safety net so that people and nonprofits throughout the state don't get lost and fall through. Um, we have certain things that we're trying to do in terms of strategic alignment. I think Brian just mentioned one of those, so that we have giving that is not just for one nonprofit, but it benefits 5. And we're looking for ways that we can keep nonprofits sustainable uh, as they go forward. What we're finding, and I think what you're going to see when Lance shows this data website, you're going to maybe be surprised at how many nonprofits there are in Idaho. I think we all were, and what we can do to help keep those nonprofits moving forward, because they're going to have to pick up the bulk of the task as state and federal funds start to evaporate. So I'm going to talk mostly about Pillar 1, the storytelling piece. Excuse me. So we're going to go through 4 slides here. We're going to talk about healthcare and medical cuts at the state level. We're going to talk about SNAP and housing cuts. We're going to talk about behavioral and healthcare uh, cuts, and then reductions in philanthropic giving. As I go through each, excuse me, as we go through each of these slides, I'm going to give some examples of how these cuts might impact Idahoans. But I'm also going to ask that you either raise your hand, and if you see something out there in the real world, and you have a story that you can tell about one of these cuts and how you're seeing it impact people, either put it in the chat, and we can talk about it that way, or maybe you can raise your hand and we can just have a verbal discussion as we go through each slide. Okay, next slide, Ryan. So healthcare and Medicaid cuts. I think we're seeing these now. I've been following what's going on in the legislature, and we're seeing cut after cut after cut in the budget. I think the last total I saw was about $192 million cut that the governor is going to be asked to sign off on, which includes Medicare and healthcare costs. So this impacts what we found in the data is it's up to 40,000 Idahoans that may lose their Medicaid coverage, and an additional 35,000 that may lose their marketplace insurance, healthcare insurance. We're seeing services at risk that include in-home care, uh, rural hospital access, and provider rates. I'm personally, I have family that lives in a rural community and farms, and we have concerns that some of those hospitals are not going to be able to offer the services that they're offering today. And we're seeing budget pressure. We anticipate 2 to 6% holdbacks by the time we get out of this year's legislative session that'll affect healthcare and welfare services. What does it mean? So this is where I want people to jump in and add to maybe the story that they're seeing. Maybe a mom in Rexburg might skip a cancer screening. Maybe a diabetic in Caldwell will start rationing insulin because it's too expensive to stay on the schedule that the doctor prescribes. There may be a pregnant woman in Jerome or another rural community that misses prenatal care. These are some of the things that we're hearing. So, what I would ask the attendees to do now is if you have a story that you could share with us and the rest of the people that are on this call, please either put it into the chat so we can discuss it or raise your hand and open your mic and let's have a discussion about Medicare and healthcare cost cuts. Let me look at chat.
Hi, this is Jillian. This isn't necessarily about the cuts, but the treatment plans. With dental specifically, you have a lot of folks that are in care facilities or are in adult care facilities. And even though they're still on Medicaid and have coverage, the treatment plan is severely different. So they're pulling teeth instead of repairing them, as example, which then only causes issues downstream and long-term problems. So it's also the quality of care that they're receiving if they have the care. Um, and then when you find yourself in that situation and you don't have coverage, it's really the same solution. So pull the tooth rather than fix it based on cost.
Anyone else?
I could kind of piggyback a little bit off of that and also the instances where we've seen where, in the past where they cut, dental coverage, for Medicaid patients, that then they were seeing higher incidences of, actually deaths being attributed to delayed dental care, more trips to the emergency room, which is a lot more expensive. And that kind of comes back to that, pillar of prevention and investing in the beginning, to have those savings, not just to life and to dignity, but also it financially, it doesn't even make sense. A lot of these cuts as far as the impact on humans.
We're also seeing impact on family members taking on elder dependents so that they
Mhm.
can provide this coverage, and it's not cheap. And so that's something that is impacting in a ripple effect of, a household budget or an extended household budget, where you have family members that are carrying their students through 26 years old, or
Mhm.
they're bringing in that elder care cost. And insurance costs with my company went up across the board because of this increase in additional spouse or additional parties being on the insurance. Where before it was one cost for all of your dependents, now it's a cost per dependent, right? So that was the impact to families with insurance as well in response to this.
Mhm. Absolutely. Thank you.
If there's no other comments or stories to tell on healthcare and Medicaid cuts, let's go ahead and move on to SNAP and housing. Um, and what you're going to see, I think, when you see the scenarios in our data website, you'll get a little bit more information on each one of these four slides. Cuts to SNAP housing and legal aid. What we're seeing is there's about 136,000 Idahoans currently enrolled in the SNAP program, and 20 to 30% of those may lose that benefit, which if impacts anywhere from 27 to 40,000 people in the state. Housing and legal services, there's about a loss of $500,000 in HUD grants that we know about, and hotline usage has been reported to be down about 43%. So a significant cut there. Immigrant access, so new laws cut prenatal and food assistance for undocumented families. This is not meant to be anything political. So we're just looking at the impacts in the communities that we live in. What it means, families are skipping meals, food banks are overwhelmed. I had the opportunity to sit with the previous head of Idaho Food Bank in one of our workshops, and some of the stories that she was able to tell in terms of uh, the fact that they're just getting hit harder and harder at the food banks across the state is a little concerning for was concerning for her, and I think it should be concerning for everybody in the state. Tenants are unable to defend against wrongful evictions because of the reduction in legal aid, and seniors and children are bearing the brunt of hunger. So the most vulnerable people that live in our communities are the ones that are ending up hungry, and they're no longer receiving some of those food benefits. So again, I'm going to ask the attendees if you have a story that you've heard, or if you want to share something either in the chat or like Jillian did, just go ahead and take your mic off and we can have a short discussion on it. Um, I would ask that you do that. You
There's
guys are so
a
quiet.
there's a food bank
Yes.
about a block from my house in Nampa, and over the last year, the line to that food bank on the days when it's open has gotten longer and longer and longer to the point where it's easily out of the parking lot now. People are circling, waiting for a chance to join the line and showing up an hour early before it even opens.
I've been a big part of the Canyon County Festival of Trees, and their primary beneficiary is a Meals on Wheels program in Canyon County. And there's been, discussions about cuts to that Meals on Wheels program. And when we think about, food insecurity, for seniors especially, it doesn't just necessarily even come down to food, but also having that second set of eyes, maybe that one person who contacts somebody every week or several times a week, to make sure that they're okay. It really is more than just about food. It's about uh, being able to have the ability and the infrastructure to reach out to seniors and to have seniors still be connected to their community and have that welfare check that they become accustomed to. And that's just one example of how that one of the impacts that cuts would have in this area.
Anyone else have anything that they'd like to share on this one, or should we go ahead and move to number 3? Okay,
I'm a
looks
housing
like
wonk, so I'll just note in addition, the cut in HUD grants, as you noted, Foster, is related to legal prevention. It's notable that that is prevention funding, and research shows that when that prevention funding gets cut, houses will fall through that prevention barrier and become more likely to face eviction, to face homelessness, which in turn becomes very expensive in terms of more reactive services. So these cuts, as Brian was talking about, can have very expensive consequences down the line.
point. Thank you, Lance. Let's go ahead and move on to the next slide. Behavioral health and recovery services. Um, Federal cuts, so we're seeing the I don't even know if I can pronounce the acronym, so I'll just say it. The SAMHSA supported recovery programs are being cut at the federal level. In the local impact, we're seeing just under 50 million in federal healthcare grants lost, and that's reducing the amount of mental health support that is available in the community. What does that mean? Increased relapses and overdoses, longer wait lists, fewer peer support staff, loss of rural recovery access. It seems like every week we hear a story about a shooting on a school campus, for example. And the person that maybe committed these acts or is suspected of committing these acts always seems to have a history of mental illness. This is another example of not helping uh, with something upstream and then having to deal with the consequences downstream of not helping people that need to have this kind of support. I've kind of been going through this. This is the third time I'll ask, but does anybody have any stories that they'd like to share with us on behavioral health and recovery services and how that might be impacting somebody either in your community or family?
Foster, excuse me for interrupting. This is Cherie Buckner Webb. Can you hear me?
Mhm.
Yes.
I never
Hi,
could get
Sheree.
in on my computer, and I've been saying, please let me in, let me in. So I apologize. I'm doing it on my phone now. At least I'm here. Thank you.
Welcome.
Yeah, happy to have you here.
I apologize. I don't know what's up. Go ahead.
No stories to share on this one. Let me check the chat real quick. Okay, it looks like there's nothing there. So let's go to the last one. So one of the things we heard in each, I think, of the 11 listening sessions we did last June was that there's going to be a decline in giving. So I think the number that we heard was there's about a shortage of, and if you're still on, Blossom, you can correct my number here. I think we heard that there was going to be a loss of about $300 million in funds that were being cut either at the state or the federal level. And the funding organizations that we talked to were concerned because they knew that they couldn't make that gap up. What we're seeing was individual giving is down about 2.5% in 2023. We're seeing foundation giving is up slightly, but it can't make that gap up of the shortage that we're seeing in cuts from the federal and state level. And they're also concerned that there's a possibility that new federal income tax proposals could raise the excise tax on charitable foundations up to 600%. So they won't be able to give the same amount of money out, and they're trying to figure out, just like most nonprofits that we talk to, what does my alternate budget look like and what changes can I make so that I can continue to support people, but I need to figure out what the best way to do that is. We heard that over and over again.
Hey, Foster,
What does it mean?
Foster,
Yes.
this is Blossom. I'm going to jump in real quick, just to let you know that that foundation bullet on the excise taxes, that did not happen at the federal level. And the other piece is that philanthropy that is giving in Idaho would have to give away more than 4 times what they give away annually, and there's no way they can do that. So that speaks specifically to the gap that the nonprofits are experiencing in their budgets, and it won't be made up by foundations, whether private or public.
Thank you, Klaus. Are there any nonprofits or anybody else out there that would like to share a story on how the reduction in giving and funding to you might impact your organization as we go forward into 2026 and 2027?
Well,
Check your chat.
Foster, let me jump back in on that one as well, because we're seeing with Idaho Partners for Good, we're seeing directly more need for help raising funds. That's one of the reasons why we're testing out the Idaho Gives concept, because we really do believe that collaboration and innovation in the funding area will help everybody. But we need the philanthropic side of things to de-risk that for the nonprofit sector. So I know we have a couple of philanthropists on the call today, and I'm hoping that as they look at their new season of applications coming in, that they'll realize that maybe they can serve as a lever to incentivize some innovation in the sector.
The data that I've seen around declines in charitable, especially individual charitable giving, also seem to suggest that a lot of that decline is happening in the working and middle class. Working and middle classes in particular are donating less, in part because I think that shows related to these other slides that these folks are increasingly cash strapped. That's also, though, a lifeline, a source of connection between nonprofits, the philanthropic community, and the working and middle class that I worry is becoming increasingly fragile.
Yeah, I think this is a good opportunity also to talk about, this is discussions about our Alice population. Foster and Blossom, could you talk a little bit more about that Alice, the Alice component of these actual human impact that we're talking about here?
I'll step back in. Just FYI, guys, I'm back home on my island, so it's 6:04 here. That's why I don't have my face on camera. Um, anyway, the Alice population is the population in Idaho that actually fuels our economy. They are Alice stands for asset limited, income constricted, employed. These are the people who are employed gainfully and often two to three jobs and are trying to keep a roof over their heads, their families' heads. So this is a population that really, really is getting hit in a big way. So if they go down, the rest of our economy goes down essentially. So we have to come alongside and make sure that families in Idaho and this population is growing. That just so you know, it's at 41% now and it's going up. So we've got to keep our eye on the ball.
Just it's important to note that when we're having these discussions about healthcare and about food insecurity and housing and mental health, this is who we're talking about. We're not talking about this small segment, on the fringes. We're talking, literally about our neighbors.
All right, why don't we move on to the data piece? So I'm going to go ahead and turn this next section over to Lance. So go ahead and if you can click on the website, Lance can kind of talk everybody through what we're seeing.
Thank you, Foster. I'm putting a link to the website in chat too, just in case it's hard to click on the screen or whatever other resource you've got in front of you.
Let's try that. It didn't like it for a moment, so.
Gotcha. So I'm a data nerd, so I'm going to jump in with the methodology and then I'll tell you what that means. So this data set is largely based on IRS 990 extract data provided by the IRS. And they collect this from every nonprofit that submits either a 990 form or a 990 EZ form. So because EZ forms are included, we have a lot of even very small organizations. Overall, in the data set, in fact, we've got 10,463 organizations represented. That said, some of these are very small, and there's even a possibility that some of these are defunct. So we're continuing to refine the data associated with this website. And as I'll mention a few other times, this is a work in progress, and we're continually trying to tie in all of these different streams that we've talked to. How do we turn that into a more comprehensive picture of the challenges faced in the state of Idaho as the funding environment continues to shift? So what we do is we take that baseline of those 10,000 nonprofits and we connect that to Secretary of State records, which has some more information about the nonprofits that we can pull from, as well as geocoding. We find the nonprofit's address provided in 990 forms, and we use that to figure out which part of the state they fall in, including which legislative districts. Then we tie that to the legislative database, which includes information on all of the legislators representing each of those districts.
Okay, so Lance, real quick, I can't see the website. Can anybody else?
Yeah, that's what I was going to pause this really quick and see. I wonder if it might work better if Lance screen shares so that he can navigate through it. Or what would be, okay, yep, perfect. Awesome.
Okay, I'll share now.
Yep, perfect. So, because I was like, because I'm going to be navigating, there'll be the Penn and Teller thing. So,
Right. Okay, so here's what I'm looking at right now. This is the methodology page that shows you where this data is coming from, as well as the update schedule that we hope to keep this data up to date on. So because we've got all of this data,
Lance,
yes.
we still can't, at least I can't
Yeah.
see the site.
Oh, I
Looks
can,
like we're still looking at Brian's.
Yeah.
Huh. because I can see it.
You can, okay.
Huh.
Yeah.
I've got the green box around the website like I'm sharing, but who knows
Can
what
others
Julie's
can
thinking.
others see?
I
It
can just
just
see my
went green.
presentation.
I can
Split
see it.
screen?
It went green for a moment and then it came, now it's come back green again, but
Hmm.
I can see it on my phone, but I can't see that it's active.
Are we reading data, methodology, and sources at the top of the website?
Yes, that's
No.
the
Okay,
page.
yeah, I can see it.
Okay.
Okay.
As long as most, well, yeah, the important people should be presenters don't need to see it. As long as our guests can see it, that's the most important part.
I'll make sure to mention which tab I'm on, and then if you can click on that link in the chat, that should take you to this same page
Mhm.
where you can go through those same tabs. So I've talked a little bit about where the data comes from, and we're working on constantly looking for new sources of data that might help to better inform this and work those into this core data. So again, this is a work in progress. But based on the data that we've already got in here, we've got some functionality that allows you to, for example, explore nonprofits across the state. And we also have a couple of different forms of impact scenarios. If I head into exploring nonprofits, that'll take me to the organization search tab. And here I can search for all of the nonprofits in that database that I mentioned across the state. I can search by either a nonprofit name, search by a legislator, or search by a district. So for example, here we can see first nonprofit that comes up is Moses Song Ministries. They're in District 1 in Boundary County. And they have the following representatives: Regina Merrill, Sage Dixon, and Mark Souter. And then there's links to full details that you can explore more. I'll spare you from looking at all the details of every nonprofit in this data set, but there's a massive amount of information that you can collect here. We also take this data and we tie it into different impact scenarios. So for example, if I click on budget cut regional impact on the left here, that'll take me to an impact scenarios and criticality analysis page. If I come down to filter by the impact area, I'll click on healthcare and Medicaid cuts. What that'll do is that'll bring up a map. And this map is colored by criticality. Criticality is calculated largely on how many nonprofits belong to that specialization in that location per capita. So you might have a large number of nonprofits, but if you've got a massive population, those larger number of nonprofits still might not have the capacity to keep up. Whereas in a more rural area, you may have only one or two nonprofits, but even then it depends on the size and extent of those nonprofits, how much of a reach you've got. So again, we're working on finding ways to better measure this reach as well. But if I click on a particular location in the state, let's say the middle of the state, District 8, it'll give me an impact analysis around my filter subject. That's healthcare and Medicaid. Here I can see it's got a 6.9 criticality score based on that density of nonprofits. It tells me that there are 27 nonprofits related to this subject in this district. Here's the population affected by this, and here are the number of total nonprofits in the district. I can scroll down here and see the specific nonprofits that might be affected by funding cuts in this district. So for example, Allies Linked for the Prevention of HIV and AIDS, or First Call Hospice Foundation. Down here at the bottom, I can see representatives for District 8, as well as their contact information. Looking at a couple of other scenarios, I'll just show you how it changes. Housing instability. You can see Idaho's a fast-growing state, and so housing instability is noted as a high level of criticality pretty much across the state. I can say right now South Central Idaho in particular has been growing at a very fast rate and has a relatively low number of housing services on offer. So they've got a very high criticality, you might say, going forward. Does anybody have any questions about what I've shown so far before I jump into demographic impact?
I just wanted to share with any of the viewers on Zoom, there's a separate tab with a orange box that says LM, and that's where I was able to view his screen. So if you haven't tabbed over to that or you have that available, you might be able to see.
Lance, one of the other things that I'd mentioned here is we did get this by voting district because that's where the information was available from. Being able to look at all of the other nonprofits that do similar work, excuse me, inside of your district, and then being able to see who your state representatives were. The hope was that we could do some collaboration between different nonprofits, and they would be able to maybe write a letter to a congressman or to their state legislator saying, "Hey, please don't drop funding in this area," and have it co-signed maybe by three or four or six or eight different nonprofits, so that the people that represent us at the state house would understand their decisions are impacting more uh, deeply into the nonprofit area than they may have realized before. So that's one of the reasons it was cut this way.
Right. The last feature I wanted to show is this demographic impact. And this is essentially showing the same kind of information, but at a different level of analysis or a different scale. So this is noting some of the stuff we've already gone over, but let's say I want to understand statewide the impact of housing assistance and HUD cuts. If I click on this, it'll give me some information, talk about some sub-services that are affected here, but I can look at different impact levels. So expected cuts would be 20 to 25% reduction in federal housing assistance. I'll stick with expected cuts for now. If I scroll down to the bottom here, it'll tell me there are about 1.6 million people in Idaho living in districts that would be affected by these cuts. 122 nonprofits are expected to be affected. Capacity loss, I think, is still under construction. And you've got 31 legislative districts that span the effect of these cuts. I think the risk assessment is also still under construction to some degree, but as I mentioned, housing is high criticality already in the state. So we can see there are 122 high-risk nonprofits that are expected to struggle to maintain services in the state. And again, we've got district overviews. Any questions on this page?
Do you also have this broken down by school district? I feel like educators would find this information, like the school districts would find this very helpful if it was narrowed down by that filter.
So this is still a prototype. And I think Lance is going to talk about some other areas that we'd like to make improvements. That includes by county, by city. So we'd like to be able to break it down even further. If you're talking about getting down to school districts, yeah, that's something that we would like to be able to accomplish. We just haven't been able to make it yet. We'll probably we need to do a little bit more work and then prioritize. Excuse me again, where we put the resources to make the improvements. But yeah, that's a great input. Thank you.
Right.
Absolutely.
We're specifically excited about this platform because it gives us so much flexibility to build onto it in those kind of ways. Because we've got the IRS nonprofit data at the individual level, we know where the location of at least 89% of those nonprofits is to the pinpoint or pretty close to it across the state. We can mix and match, break that up, or reassemble it in just about any way. The trick is just figuring out how to match other data like poverty rate, ALIS rate, etc., to that data. Okay. I will stop sharing so I can show that next slide that I was going to talk about.
Okay.
Can we switch to the next slide?
Yep. Here we go.
Okay. So these are some of the notes for improvement that we've got or that we're thinking about as we work on this website. One would be to add more resources based on those four pillars that we talked about. This might be resources like pulling in ALICE data we've got here on the list down here, or childcare and education data. We've also got county health rankings supported by the Robert Wood Johnson Foundation that includes information at the county level on all kinds of determinants of health. We've also got a distressed communities index put together by the Economic Innovation Group that looks at communities that are distressed or at the potential to be distressed across the state that we would like to figure out a way to bring into this so that not only can you see the criticality on the level of number of nonprofits, density of nonprofits, but you can think on a more systems level of Canyon County, for example. Canyon County has a relatively high number of nonprofits, but also has a relatively high level of need. And not only if you cut services in Canyon County, not only are those individuals affected, but Canyon County is tied into a larger economy that reflects Ada County's workforce as well. There's a lot of different levels of detail that we can build in here. As we noted, we're working on different geographies, city level, county level, school district level. We're hoping to find sources for state funding to NPOs because that's a little harder to reckon for and accounts for a good percentage of funding for nonprofits in the state. We also have a student from Boise State who's, as part of a social impact challenge, has put together a really cool app that uses AI and characteristics of nonprofits, including a lot of the data we're already looking at, to find opportunities to build bridges, build connections across nonprofits. And we're looking at ways to build that app that he's developed into this site as well to help people better find connections to perhaps search for opportunities for joint funding requests or opportunities for strategic partnerships. Finally, another challenge in the data is figuring out. So I mentioned Canyon County, Ada County, there's a lot of nonprofits there, but Owyhee County does not have many nonprofits in it, but a good number of the nonprofits in Canyon County and Ada County extend services to Owyhee County. And it's really tricky to get at that in the data because that's not something that nonprofits report on in IRS data. So we're still trying to find a good source and a good way to measure nonprofit program data compared to where that nonprofit is actually registered. We're hoping to build in maybe some kind of feedback loop in the website itself where nonprofits can share that information with us. Any questions about this slide or any thoughts on opportunities we should be keeping an eye out for?
I'd like to ask those on this call, no matter which hat you wear, is this kind of data the kind of data that will help you to tell your story, that will help make your populations visible? I think that that's really what we want to make sure that we are dialed in on is how does this help our nonprofit sector, our philanthropic sector, our policymakers make the right decisions? Jillian, did you want to say something, Jillian? No, okay.
Nodding. Right. Thank you so much, Lance, for going over all of that and, explaining that walkthrough. And it's really exciting to see how it develops and how the information, how we're going to be able to use this information to help people. So coming back to storytelling, using our different strengths and our different talents. We need data because we need to actually know what's going on versus guessing. And we all know, the law of good intent, the road to hell with good intentions, these different things to understand how policy actually is impacting people as opposed to what its intended, purposes were, what the unintended cause and effect is of things. Recently, there was a story out of Idaho Falls where a mom with her children had a really scary interaction with someone that was having a mental health crisis. And being able to see that when we have these cuts, when we have a lack of support, when we're seeing some of these programs suffer statewide, nonprofit level, private, public, all across the board, that there's real impact on people. And I think that this is this perfect synthesis of where we have data and then we have a real story. This mom in Idaho Falls out in front of the museum, she isn't a data point, she's a person. She's a neighbor. She's somebody that was minding her own business and came, front and center, up real close and personal with data, with the impact of what data is. And sometimes as nonprofits, we have a hard time telling these stories because we don't like to make exhibits out of the people that we're helping. And so that makes it a little bit harder for us to tell those stories. So let's have a little bit of open discussion about how we can do a better job merging data and stories together to help motivate people, to help mobilize people, to help paint the real picture about what's going on in our state.
I just have a quick question on this. So will you be kind of gatekeeping the access with providing username and logon, or will this be just general access to the public? Or has that not been determined yet?
I don't think it's been determined yet. I think ideally it would be open to anybody that needed to use it. Um, so I guess stay tuned. It's still,
Good question.
I would still consider this to be a prototype, we called it a draft. But we want to build it out so that it's actually useful for anyone to go in and find information, and then be able to use that data to make decisions to help their nonprofit.
So, Jillian, there's three primary users for this website. It is the nonprofit sector, the philanthropic sector, and the policymakers. So, if we can help them make decisions better based on both stories and data, then we believe that is when when there's going to be a lot of lift and a lot of uniting across legislative districts, communities, and sectors.
I would almost suggest that while you provide access to anyone, there's a, even if it's a visual YouTube training, right? Like, what is this data meant for? Not just how to navigate it, but how you leverage it wisely. I think that should be the requirement before the access is granted, like almost like a drop training on it, and creating a username and passcode system similar to like a title company before you can get into a fee estimate and access to taxes and things, HOA dues. It's kind of along those same lines, where you have to at least level up the experience for the user before you give them access to the data. That's my personal opinion. Where I see this being extremely useful is going to be the grant writer for the organization, right? Everything they do is based on data, and that really helps them support the pillars and the narrative. I also see this as a useful tool for businesses that have charitable contributions in mind, right? And so they can figure out where their focused efforts will make the best impact for their community. So I don't just see this as a nonprofit tool. for me, when I was building my business plan on how to impact the community, this would have been extremely helpful. So there's a lot of uses for businesses in addition to um, nonprofits, and I see the school districts also having the opportunity to leverage this data for what they're lobbying in their space as well. So this is a broad paint stroke that you're creating from, and the amount of data that you're having to stay up to date with it, to me, that's overwhelming. But I'm not a digital person. But for the point of that is, if you're putting that much energy, effort, and bandwidth into creating accurate and detailed resources like this, there is a broader audience past nonprofits that I think will help sustain this. And maybe it's available free for nonprofits, but then you can fundraise through corporations for that access, so that you can keep the most up to date and accurate information. Because this could be a paywall opportunity given the quality of the data that you're compiling. So that's just the consumer in me talking, but I would have paid for access to this, right, to give a quality business plan. So just giving you that real world perspective.
Thank you so much. That is awesome. This is exactly the type of feedback, that we're looking for. We need this collaboration. We need people across collaboration, we've been talking about, to be able to inform what we're doing and do it better, to be able to help more people. So, comes back to, we have a few minutes left. Does anybody have any questions or any thoughts or concerns or anything that they would like to share with us? Something that we can do to help move this forward? Okay.
I didn't know, is Chris on this morning? Chris, are you out there? No. Ray, are you out there?
Yeah, I'm here. I'm listening.
Oh, okay. Okay. So can you are queen of marketing and communications here, and so the framework of making things visible. Do you have a story that you could end us up on that highlights that?
I think continue doing what you're doing and getting it out there and sharing and encouraging others to share is helpful. Obviously, it's going to have the ripple effect and fuel word of mouth and do the things that continue to help fuel word of mouth. So making sure that you're continuing to invite the right people and then encouraging the people who are here to also encourage others to join in the conversations and participate and share it out on social medias and all the different channels that they can organically. And I know we've talked about potentially having some funding to help fuel that even further with some boosted posts and boosted things that we can share within the community groups. There's some pretty active Facebook groups and LinkedIn groups that are getting some traction, I believe, and then partnering with others that will be willing to partner with us to help continue to get the message out. And working with media and pitching the media will also be something I think that could be beneficial. I like the fact that you're working with some students to train them on how the way of the world that works. But also if you can get additional interns and interns can sometimes work for free, although the experience that they get is what their payment should be. So I think that's a valuable asset for our community to do that. The other thing I was thinking about really is at the top of the program here, you mentioned some heavy hitters and names of people that are involved or that want to participate. I think that can leverage and say, oh well, if that person's involved, maybe I should too. And so I think being able to quote those people and make that public if they are willing to do so, and having kind of those quotable moments that then can help be shared and fueled can continue to bring out the message that, this needs to be known and how to continue to do that. I like how we've, kind of truncated some of it just to make it short and sweet and palatable for people to be able to repeat and share. So just reinforcing those messages and short little things, especially that now where everyone just wants, 20 seconds or less of sound bites or, just information that can come up in the feed. So video is going to be helpful to listen to. So continuing to talk to the powerful people that have influence can be, I think, a benefit to reinforce and support.
Thank you so much, Ray. And again, Ray is one of our amazing consultants, which is something else that I'll just kind of let Foster speak to a little bit. We do have amazing, team of consultants. So Foster, if you want to speak to a little bit to that, and then we will take it home. Oops, you're on mute. You're on mute, Foster. There
What I said was really good. So
It was great. I'm sure the first time was the best time.
one of the ways that we fund some of the work that we do is through offering consulting services. And we have a large number of consultants that can come and help either a nonprofit or a business. We're trying to use that money that we raise through the consulting services. It's a shared dollar amount, so it's a 60-40 split. We take the 40% of payment and we throw that back into the community in one way or another to help organizations. So it's been a good model, and I think we'll continue to do that. So if you have any need for consulting work, whether it's project management or accounting or marketing, please let us know if we can help you. We would be happy to come in and do that.
Okay, again, you can catch our Nonprofit Success Labs on our YouTube channel. We will be sending this out to everybody who participated today or was interested in participating. Again, you can reach out to us at any point. If you have any questions, you want to get involved, need something to share. Again, we appreciate each and every one of you for taking the time out of your day to participate with us today.
I have one more thing that I'd like to share. We're trying to also put together, so this isn't just a IP4G effort. We're trying to get other people involved. So if you have an interest in working with us, we're trying to put together some steering committee to help push certain things forward. I think the idea of having media involved is a good one. So if you have an interest, I think everybody knows how to get a hold of Blossom. If you have an interest in helping support us in some way or another, please go ahead and get a hold of Blossom and we'll find a place for you that fits in your schedule as well as how much your time commitment would be. So please do that if you have an interest in helping.
I was just going to add, I added my LinkedIn, and if there's other ways that we can all be connected, I would encourage others to do the same so that we can connect outside of this, but in other ways too, and join the conversation. And whenever IPG for Good or Idaho Partners for Good posts something and you see something that they're doing, I encourage you all to make a comment or like or do something to make it visible.
Thank you so much, Ray.
And Jawadul, if you'll stay on once we conclude, that would be awesome. Okay.
Thank you, everyone, and have a wonderful day.
Thank you.
Thank you.